If you are a patient who has had an MRI and been told everything looked normal, what if there was still hidden damage your doctor couldn't see? What if AI could uncover that earlier, giving you a chance to act sooner? Well, that is now possible. Hi, I'm Raj from TheraTrek. Today we are talking about a new FDA-cleared AI tool called Tempus Pixel, a platform that helps doctors get more out of MRI scans. It doesn't change the MRI machine itself, but it can reveal tissue-level heart changes that standard MRI machines might miss. And here's why it matters to patients. Traditional MRI images show brightness, contrast, shades of gray, but they don't always tell you how much damage or inflammation is there. Tempus Pixel generates T1 and T2 maps from raw MRI data, even from old MRI machines. These are detailed maps that show things like fibrosis, which is scarring, inflammation or excess fluid, which is edema. Importantly, even if your MRI machine is old or doesn't have special mapping built in, Pixel can still extract those maps, so patients who haven't had access to the latest MRI hardware may benefit. For example, countries where they don't have the latest MRI hardware can still use the AI to use the images from the MRI to create T1 and T2 maps and get greater insight. So here's a chart I would like to walk you through. As you can see, there are many conditions in which the T1 and T2 maps generated by Pixel can help. The first one is myocarditis, heart inflammation, and early diagnosis helps prevent permanent damage. And heart attack, acute or past MI, identifies injured areas, distinguishes old scars versus new damage. Cardiomyopathies, patients on certain cancer treatment could have some conditions where these maps facilitate cardiac monitoring and toxicity prevention. And heart transplant recipients also can benefit from T1, T2 maps. And systemic diseases affecting the heart can also be a subject that can benefit, because the T1, T2 mapping tools can help detect early tissue changes in diseases like rheumatologic disorders, and it identifies cardiac involvement prior to overt symptoms. Recently, Tempus Pixel got FDA 501(k) clearance for an updated version of Pixel, which now supports inline T1 and T2 mapping. That means the mapping is generated directly from the raw MRI data, even when the MRI scanner doesn't natively produce those maps. In other words, old MRI machines can still be useful because the data that they produce can be interpreted by Tempus AI's Pixel to create T1 and T2 maps. It gives radiologists and radiologists more precise tools to see subtle damage earlier. That can lead to earlier treatments, potentially better outcomes. And I think mapping is helpful, but not a guarantee. It complements existing tools, not replace them. There may be variability in what normal looks like, depending on age, scanner strength, sequence differences. Interpretation still depends on the skill of the specialists, and access might be limited depending on the hospital or imaging center, insurance coverage, etc. So if you are someone who has had unexplained heart symptoms like chest pain, fatigue, shortness of breath, etc., or is getting treated for myocarditis, or is at risk of heart damage because of treatments or chronic disease, Tempus Pixel may offer something new, a chance to see what was once hidden, possibly earlier in the process, so that you can, when you go through an MRI, the amount of detail that comes out in the image, thanks to Tempus Pixel, can help your radiologist to identify symptoms way before they manifest themselves, and your cardiologist can start treating you earlier. Talk with your cardiologist about whether these newer MRI tools are available in your area and could help in your case. Friends, if you found this video helpful, please share this video with someone who might benefit, and subscribe to TheraTrek so that you are in the know about new tools that change how medicine works, and also about new therapies. I'll catch up with you again in the next video. Bye for now.